Hi everybody, it's Dr. Jeff Pierce from Michigan Sports and Spine. We're definitely in double digits doing this show, and we're getting a lot of feedback. Actually, the patients are talking to me that they know about it, that they're out golfing, so they missed the show. So just so you know, and you can tell people who aren't listening, that this always sits on our Facebook Live, and it also sits on our website. So if you've missed a show or someone's missed a show or you think it was a good show and you want to share it, you can definitely get it through our website and our Facebook Live, and now we're even on Instagram with little snippets. And we're going to be switching gears a little bit too. We're going to start doing like little trailers, getting feedback from you before the show and get those things out there. So we're definitely encouraged by the amount of questions we get, and even one of the patients today, which I'll get to in a few minutes. So to kind of jump in, question 1 says, I had a spinal fusion of L4-5. It was effective in reducing my pain. My surgeon says I need another spinal fusion in a different area, but that if multiple vertebral bodies are fused together, it may limit motion and could even lead to additional pain. What's your take on this? So this is kind of pretty common. So basically, to summarize, the patient had a simple fusion of 2 segments. I don't know the date, but probably let's assume it was a couple years ago. It's not uncommon, and most of the surgeons will tell you, once we fuse the 2 levels, above and below start wearing out faster. And it's a very common thing which can lead to further surgery. So when you fuse, it's actually taking the bones and literally fusing them together. If it's just bone, or if it's with hardware, where it's literally bolts and screws and rods. In this case, excuse me. In this case, that's probably what the situation is. And the doctor is right by telling this person that if you continue to fuse more areas, it's definitely going to limit the motion, because you're going to put solid rods in there to fuse it to create stability. Well, you create stability in the spine, but you also, for that, you reduce the amount of movement you have. So yeah, you are going to have a problem. Will that lead to more pain? Technically, the answer is no. The reason to do surgery is to reduce the amount of pain, is to increase your functionality. So you're doing surgery for multiple reasons. One is to reduce what's causing the discomfort. 2, you want to create stability. So you have to work even harder, meaning that you need to work on the core strength even before surgery. So the better you are with that coming into surgery, what I call your infrastructure is going to be more stabilized, so you can take on more and hopefully need less is what the goal is. So anybody who's talking to me about surgery right now, I'm saying less is more. Meaning, we're doing what we call the roto-rooter, where we're opening up the openings where the nerves are. So here's my friendly spine again. So it's in front, in back, this is the bone, this is the disc, these are the nerves. So a lot of times, hopefully, you're talking about these foramens, the openings, where the nerve comes out, and we go in there and we kind of open that up a little bit more instead of taking off this whole lamina. So a lot of times when we talk about laminectomy, we're taking this piece off here, and then they're fusing the 2 together, because if you remove this, you lose all this stability. Okay, if I just go in and clean this area up, then I'm not losing that major stability. So this is from a surgical standpoint. Some surgeons may argue that I don't know what I'm talking about, but in a basic knowledge, that's what we're doing. You're trying to, 1, free up this nerve so it's not being pinched, causing the pain. And 2, the disc heights start becoming less. They start shrinking. So as they shrink, these openings here become less available, and then compromises the nerve itself. The other big thing where you run into bigger problems is stenosis of the whole thing. That's where you have to have all that cleaned out and the disc material removed. And sometimes you can't do less is more. You have to do what's necessary. So to answer your question, if you did the 2 segments here, you still can have movement of all the other segments, including your upper spine. If you start fusing more, you're obviously going to limit the amount of movement here and be as stiff as this thing is, where you're not really seeing a whole lot of movement, and then it should create stability. It should not, create additional pain. So that's probably needs to be assessed a little bit more on what exactly he means. So my take on it overall is basically, if you unfortunately need a further surgery for stabilization, then you're going to lose motion. Okay, so as you create that stabilization, you're going to lose motion. I guess my question is, have you talked to a non-surgical spine doctor to get a better opinion, or another opinion would be my first thing. If you're just creating major instability and your disc are slipping and the bone is slipping, then that's an issue where you do need to be stabilized. So if I could see you, or you see someone like me, you're going to get a better answer. But to answer the question straight up, if he does fuse more, you're going to lose mobility. Ideally, you shouldn't have more discomfort. You'll have limitations, but you should not have more discomfort. Then why are you doing the surgery? Okay, so the next question, hopefully that answers your question. If not, we'll be welcome to get you in the office and give you my 2 cents after I'm able to examine you. The next question, it says, previous question, it says, I have been having extreme pain in my left arm and left side of my neck with occasional headaches. I had a reaction to the steroid my doctor gave me. Do you treat something like this, and if so, what would I do next? Do you have any remedies for pain on my left side? Okay, so yes, do we treat this? Absolutely. We do neck, arm pain, we do all that. So we're called Michigan Sports and Spine, so it's the spine, which we do a ton of work on from the base of your skull all the way to your tailbone. But we do the sports part, which I don't want to be intimidating that it's only athletes. We call it industrial athletes, weekend warriors, parents are athletes, taking care of kids. So it encompasses everybody. So when we call it Michigan Sports and Spine, we encompass everything that's non-surgical. Am I great at everything? No, but we've had a lot of 20 plus years history of treating everything. This actually falls right into our wheelhouse, exactly what we do. We deal with the arm, we deal with the neck on a regular basis, and we feel very confident in treating that. So what do we do if you can't have steroids? There's other type of medications. I know I always talk about platelet-rich plasma. That's a perfect person. You're a perfect candidate for platelet-rich plasma because one, when we do injections, the most common is steroid. Now becoming more popular is becoming platelet-rich plasma, again, which is from your blood. We take the healing cascade out of your blood in a higher concentration and inject it into the injured area. As far as your left arm, I'm concerned because if that left arm is creating discomfort or pain, and it's coming from your neck, it's one of our red flags to be very aggressive in our treatment. So this could be a pretty, I don't want to say serious, but a concerning problem that needs to come in right away. Excuse me. So yes, do we have any remedies for the pain on my left side? We absolutely do. It's not just steroids. There's other medications that we use. The PRP would be appropriate, but more importantly, it's the potential of therapy, what we call the do's and don'ts, home exercise, and medication. So there's a lot of other things we can do for that. So again, we don't want to be misleading that we only do spine work or we only do neck and back. I do a ton of athletes. I've covered a ton of professional college and high school teams to the point that we're able to take care of everything. Take care of a lot of the entertainers. They're not just spine injuries. So to feel comfortable for knee pain, ankle pain, hip pain, every part of your body we pretty much can have an opinion on. The good things with me is that if I don't feel comfortable with it, I will get you to another doctor who I feel confident that can handle it. So that's been our message overall. We don't bite off more than we can chew type of attitude. Especially with the new doctor, we've now expanded our practice that we even are more encompassing. So hopefully that'll help you. But on a serious note, if you have not seen us, and this is still a problem, and it's causing headaches and left side arm pain, that's a red flag for us that needs to be treated quickly. All right, so question 3. I've been dealing with back pain for years now. My work requires me to stand for long periods of time. I was managing it pretty well. Physical therapy and my home exercise program were really helping. Then I was furloughed for 3 months, and after 1 week of returning to the job, I'm in more pain which was expected, but the home exercises aren't helping anymore. What do you suggest how to handle this? So it's funny because if you go back to my earlier shows, I addressed this and highlighted this as a potential problem and a concerning problem that I was worried about. And here it's coming in live with one of our older patients. So what you need to do is really get back to not square one, but from the basic areas. Meaning we may have to get you back to physical therapy. The worst thing you can do is wait for this to snowball and become worse. So I always give the example, if you think of a snowball at the top of the hill, it's very small and manageable and you can beat it. If it starts rolling downhill and accumulating more problems, it's much harder to treat. So you do need to be aggressive. Considering you already have a history of back issues for a long period of time, you're flaring up, we need to address that in an aggressive, quick manner so it doesn't get to where it's back to injections and it's back to doing long-term therapy, and potentially, you lead to surgical issues. So being off for the 3 months, I'm hoping you were trying to do what's right with your back. Being back on the job, you're having more pain than ever. You need to get in. This is something I always say, even with all my patients, it's basically if you're doing well and all of a sudden you get more discomfort and it continues to increase over 5 to 7 days, you need to get in. If it's absolutely terrible after 3 days, you need to get in. Do not wait. If you start getting better after 5 days, but you're not like 75% better, you need to get in and get a program. So it may just be just tuning things up, adjusting a few things at work. There's a lot of options that we can come up with for you to reduce the amount of discomfort. But the main message is, do not let this thing get worse. Do not let it snowball on you. If it's a message to you that you need to be more aggressive with your therapy, take your medications, do exactly what you were doing before, then get on it. Don't wait. Don't I'm too tired from work. I can't do my exercise. I'm not going to do my stretches. That's just going to snowball on you and get gradually worse. So the overall message is, get in to see us or whoever the doctor is. At this point, you said you saw us in the past. I don't know how long ago it was, and we had you on a good maintenance program. And we want to be able to not lose everything we've gained. Okay, so it's time for one of my stories. One of the stories today was I have a patient who says she's not on Facebook Live, so we can talk about her. But bottom line is, she's someone that, again, a lot of people don't like me right off the bat when you first see me because I'm very direct. I'm like, this is what's wrong, this is what we need to do. Hopefully I'm able to figure out the diagnosis very quickly. But a lot of times I'm here to help you be educated, but also not limit yourself. So this person was on a lot of medication. She was taking a lot of pills each month. We won't talk about the amount, but there were narcotics. I was uncomfortable with the amount she was taking. So the first thing I said is we need to cut this in half. You're coming in here with all this medications and your pain level is 8 out of 10, and is it really doing what we need to do? Are you really doing what you need to do? And this is a younger person that hasn't been working. So 6 months later, which is basically what I say, and I've said it on this show before, is you may hate me for 6 months, but then you might be able to thank me. And this is another classic story where it was today, and she exactly that, is that she's down to 1 pill a day versus 5 to 6 pills a day. She's back to work for the first time in 7 years. She's enjoying her job. She's enjoying her life. She feels like she has a purpose again. And she's like, Dr. Beers, I'll admit I did not like you at the beginning, but I'm so thankful. And she goes, I may get real mean right now, but she was out of medications for 2 weeks and she actually made it through. She was finding all the other things that we suggested that she started trying. She says they all work. And this is someone who's had multiple surgeries. So I'm not going to tell you, I'll tell you the bad stories too, but not now. But basically, you got to trust what we're doing. You got to trust the system. It's not perfect. Anyone who sits there and tells you, I'm going to make you 100% pain-free after being pain-free years, I would run from that person. For us, I try to be very realistic. If you follow ABC, all the way to Z, you're going to do better. You're going to be more pain-free. You're going to have a better, I mean, this was a young person. I'm like, we're worried about the next 40 to 50 years with you. And they get it. You can't be on these narcotics. You can't be on these opioids. It's going to wear out your system. You're like, well, I'm not being bothered now. You add 10 years to that, you're going to have a problem. You're having a problem that your infrastructure, your core that I talk about, if you don't work with that, gets weaker every year. If we do nothing every year, we gain 5 pounds. And that's just the American way. So you start adding 10 years to that, that's 50 pounds. That's if you're behaving. That doesn't, that's if you're working out at a very minimal level. So there's all these accumulative things you've got to be worried about to take into account. So this was a great story. It makes me, it motivates me that we are doing the right thing, that people are listening, and that when the people don't listen, we're not gonna, I'm not gonna get bullied that we're doing the wrong thing. I know we're doing the right thing. People sit there and complain on my surveys that he was rude, he was abrupt, he just wants to take the medications away. He's not listening to me. He doesn't understand that my pain's different than anybody else's. I appreciate that comment, but I also appreciate that I have 20 plus years of experience. I've pretty much seen everything. I've not seen absolutely everything. But for the most part, you want to go to somebody who's comfortable with it, that's not just like half listening and like, okay, here's the medication. I'm not going to create a program for you. I'm not going to customize anything for you. I mean, if that's the patient you want to see, then we're not the right place. So we're gonna push you and test you. We need you to do it. Like when patients say, I'm doing it, we're gonna actually ask you what you're actually doing. Not like, oh, I've exercised every day. I mean, like the commercial says that my son shared with me, sometimes it's just BS. And we'll call out BS. And if you're sensitive to it, I might not be the right physician for you. All right, so that's my cute story that kind of rambled. Another one comes from something that happened today too. Can the coccyx bones be injected? So the coccyx bone is your tail. It's a fancy way of calling out your tailbone. So if the tailbone was injected and also manipulated before or after the injection, if it can help the coccyx bone, basically they're asking the tailbone if it's manipulated. So a lot of chiropractors or manual medicine or manual therapists work with the coccyx bone. Some doctors believe that it doesn't move at all. It actually does have movement. It's millimeters of movement. It's when it does move, because it's so solid, it becomes very painful in your pelvis, in your hips, and in your lower back. So we do work with certain therapists that are specialized in it. There's not a whole lot of people that will do manipulation of the coccyx, but that becomes a highly specialized area that sometimes if they can't get the movement, we'll inject it to one, reduce the amount of discomfort, but also reduce the muscle spasm and the restriction around it. So yes, we have done many injections for the coccyx, also what we call the SI joint. So the sacroiliac joint is where the pelvis and the tailbone come together. It's a very common area of what I call a secondary pain generator. So any pain in the lower back can cause referred pain to that area, and that area also has to be accounted for. When you have coccyx rotation, like I have people that fall or lose their balance or fall right onto their tailbone, there's a thrust of the tailbone that comes out. Sometimes it happens during pregnancy and delivery, that you'll get movement of that because you get loosening because of the hormones, and that becomes an issue too. So overall, the answer is yes, we do the injections. It does show benefit. We do work with therapy specialists. Not every therapist knows how to do it. It's a extra training in coccyx mobilization, and also same thing goes with your skull at where the skull comes into the top of your neck. So those are all highly specialized areas. Classically, you want to work with a manual therapist. I've always pushed for manual therapy. So when you go and you have issues like this, or that would be appropriate for our office, you're always looking for a manual therapist to help you. So hopefully that helps you that question. So question 5, do you treat more neck or back? it's funny. It goes in spurts. It's weird. I don't know if it's the way the moon and the sun are falling together, but some days I'll get like all necks and they'll all be on the right side, or all backs and all be on the left side. But I think yesterday we had a variety of things. We have knee injuries, everything like that. I'm very comfortable with both. Overall, the back injuries have been, it's probably more. If I have to really count the numbers, we probably have more back injuries. We have more neck injuries where it's a whiplash injury, but the back takes on so much more pressure. It takes on so many more issues. It's just not, the design of the human body was not good for the lower back. When you start, if you go back to evolution and everything else, and we're supposedly walking on all fours and we came upright, the neck is supported a little bit better by the head. It doesn't take on so much force and so much torque. The body, your waist is supposed to be smaller, and you have this big buttocks muscles and big chest muscles. So when we were born, your back's considered your weak link to begin with. So it's the weakest part of your body. And then if you start building up other muscles, you create that muscle imbalance that I've talked about before. When you create that muscle imbalance, and it doesn't take a whole lot to injure your back. So your back is just more of a tendency that it's more prominent of an injury. It's more common. Neck injuries are more of trauma or looking up, or to be honest, we talk about the text neck, meaning you're on your phone all day, you're at your computer all day, you're forward bent and down, you're creating weakness in the muscles there, and you're creating a forward bent motion. It's fine for young kids, but they're all going to have problems later in life. You're all going to create, again, what we call that micro trauma to the area. The micro trauma is going to continue to build up and create, I talk about the openings and the areas that are important. If you can create micro trauma into all these areas, eventually it's going to get to where this opening gets compromised. So the forward flexion, big neck injuries. So to simply answer your question, we probably at the end of the day more back. We're comfortable with all neck, all back, all non-surgical. We do more injections than most people. There's a few doctors doing a little bit more than us. I think they're pushing the envelope, but I think they're comfortable doing it and they're getting their results. For us, we feel comfortable with our success rates and the programs we have. We're very aggressive that we put it back onto you. So, in summary, we're not just sports and spine. We're everything. We take care of. When we first did this, I had a big billboard at the Palace because I was the team doctor there, and we had a big billboard where I had a football player, a professional basketball player, and a little lady on roller skates. And our motto was, we treat everyone, not just professional athletes. So we treat professional athletes and those who are far from it. So, that's the message. We treat all areas of the body, all non-surgical. We have an opinion. We feel we're open-minded. A lot of questions have come up about CBD. Do I promote it? Do I not promote it? I think we'll do a talk just on CBD oils and treatments of that. I think there is a role for it. Do I promote it? No, but I don't discourage it. I get a lot of feedback that it's working. And certain people in certain age groups have done that. So basically, steps to take before jumping back into surgery. We deal with a ton of cases stemming from improper postures, surgeries that maybe have not gone well. We don't like those cases. They're the harder cases. We'd rather catch you before you have surgery, so we know exactly what's going on. We've prevented multiple surgeries at this time. And the surgeons actually appreciate that because they don't want to have to deal with, surgical individuals that's not necessary for. So I would highly recommend seeing someone like us, or even the insurance companies where we're centers of excellence. The reason is because, like Priority Health is probably the leader in that, is that there's so many unnecessary surgeries. If you go to a surgeon, that's what he does. If you go to someone like us, we try to prevent you from surgery, but we don't keep you from surgery. So again, we're a center of excellence for HAP, Blue Cross, and Priority Health. I think those are the only three that actually have it. So managing pain over time, what do you do when you reach a plateau and the pain starts to come back after subsiding? Again, what I said in the first one, if the pain level is, if you had a bad weekend or you did something you shouldn't have, and the pain continues to get worse over 3 days, you come in right away. If it starts getting better after 5 to 7 days, but not more than 50%, we actually prioritize you if you are having that system. I know people are complaining it's a little bit harder to get in, but if you're having an emergency, I'll always get in to see you. We have Dr. Bonnet here, who's taking on new patients and new issues, and he's been of great help. So we're very well fit to take on any new issues. So everybody's going back to school. There's a lot of issues there I'm not going to get into. I'm dealing with it myself. So peace out. Love you all. Keep watching and spread the word.